With the rise in COVID-19 cases, many people have been opting for precautionary or voluntary tests to find out if they were infected or not. These tests have been offered free of charge at designated health facilities. However, the Ministry of Health has announced that it will not be administering free tests anymore, except for specific categories of people. Everybody else will have to pay for a coronavirus test. The categories of people that will have to pay for the tests are individuals seeking to know their COVID-19 status, public and private organizations that wish to test their staff for prevention, truck drivers at Uganda entry points, Ugandans returning from abroad, and visitors arriving from other countries. And those that will continue receiving free tests are patients who present to health facilities with COVID-19 symptoms, contacts of persons who have tested positive for COVID-19, community members selected for surveillance samples, and frontline medical workers. The Ministry of Health says continuing to accept voluntary tests had become unsustainable due to inadequate in-country stock of test kits, resource restraints, and high cost of COVID-19 testing.
We do not have enough test kits to cover everyone. This is a charge of 240,000 per person, and this one will support the buying of more sample collection and testing kits to support the COVID-19 response.
The introduction of COVID-19 testing fees has drawn mixed reactions.
Is government of Uganda going to protect selectively? And now if you only say voluntary testing, how do you now distinguish the others that are near this particular person that you would want to do voluntarily to test? For me, I think the approach should be inclusive.
Charging citizens 240,500 shillings for testing is madness of the highest order. People who test are not the beneficiaries of this testing. It is the public that benefits.
According to Sylvia Namubiru, the Executive Director, Legal Aid Service Providers Network, charging for the tests may breed corruption as many Ugandans, especially those travelling out, might want to pay for the certificate without being tested.
When you over-squeeze people, they always find a scapegoat. So the scapegoat is going to be corruption. And they will pretend to have tested when they have not tested. So how do we fight this? Would that not be endangering the country? And the best option is, however expensive it is very important that government takes off this obligation and does the tracing, does the testing, does the surveillance, digitalizes every process, the way we've seen some of our counterparts are doing.
There is a system that verifies the authenticity of these certificates, and we supervise all the places that are testing.
The Uganda Medical Association has proposed subsidizing the cost for the test, especially for Ugandans who may find themselves unable to pay.
Let's assume you're returning from wherever you've been with a family, and then you have to do the test for a number of people, be in quarantine, and maybe later on you're required to test again. Should you develop a symptoms, it's a problem. And also for some people, their employers are now requiring that they do the COVID test before they can be employed. Imagine you don't have a job, you don't have an income, and then you're being told to spend that money initially. So it's a problem.
The Ministry of Health says the new arrangement takes effect from Tuesday, 1st of September. Edward Mhumza, NTV.